Okay, let's dive right into this. We are standing on the precipice of a shift in healthcare so profound, researchers are literally comparing its potential impact on human progress to the mechanical revolution brought about by the steam engine. Welcome to This Explainer. Today, we're unpacking a really comprehensive narrative review by Ranjeet Singha all about artificial intelligence and physiotherapy. If you're a physiotherapy student looking ahead at your future career, or maybe an educator shaping the next generation of clinicians, this is exactly the landscape you need to understand right now.
And this brings us directly to the elephant in the room, right? It's a question that's generating both a lot of anxiety and massive excitement in our field. As machines develop the cognitive capacity to recognize these previously hidden patterns in massive datasets, what actually happens to the human clinician? Are we looking at a future where algorithms just dictate care, or one where AI acts as the ultimate empowering tool for the physiotherapist? Well, we're going to find out.
So, here's how we're going to break this all down today. 1. The AI revolution. 2. Education. 3. Clinical practice. 4. Research. 5. Limitations. And finally, 6. Future directions.
Starting off with Section 1, the AI revolution. Because healthcare is just intrinsically complex, it is a prime beneficiary of AI's data processing power. We aren't just talking about, one specific robot or a single piece of software here. AI is permeating every single layer of the profession. In education, it's virtual simulations and automated assessments. Over in clinical practice, it's diagnostic assistance, wearable technology, and predictive analytics. And in research, it's completely revolutionizing data analysis and clinical trial optimization. It's essentially a total ecosystem upgrade.
Moving right along to Section 2, AI in physiotherapy education.
For educators and students, the absolute imperative right now is AI literacy. According to a really interesting study by Scott William Lowe cited in our source, a majority of physiotherapists actually support adding AI directly into the curriculum. You're going to be consumers and practitioners of these technologies, so understanding their capabilities, and just as importantly their limits, is no longer optional, it's a foundational requirement. And this is happening in 4 key ways. First, we have adaptive learning systems that customize the pace to the learner's needs. Second, VR and AI-enhanced simulations. These are great because they allow students to practice clinical skills in totally risk-free situations, interacting with very realistic scenarios. Third, automated assessment tools that analyze biomechanics data to give you instantaneous, real-time feedback on your practical skills. And fourth, AI is even helping structure the curriculums themselves to align with incredibly fast-evolving industry standards.
The shift here is profound. Think about traditional static teaching for a second. The curriculum moves at one speed, regardless of how well an individual student is comprehending the material. But with AI adaptive learning platforms, the whole learning experience dynamically adjusts. If you master a concept, boom, it shifts you right to harder material. The data shows this keeps students far more engaged and motivated, allowing their learning process to grow at a totally personalized level.
All right, Section 3, transforming clinical practice.
Let's walk out of the classroom for a minute and step into the clinic. In clinical physiotherapy, artificial intelligence is driving a massive paradigm shift from reactive treatment to proactive and preventative care. A perfect example of this is the move from traditional, sometimes trial-and-error treatment planning to AI predictive analytics. The paper highlights some fascinating research by Vivek H. Ramanandi regarding a stroke recovery predictor. By analyzing massive amounts of patient data, including clinical measures like Barthel Index scores, which track daily living activities, these AI models can actually anticipate a stroke patient's recovery trajectory. They can even estimate hospital stay duration. This allows the physiotherapist to make just-in-time adjustments to a treatment plan, forecasting risks before they even happen. It's a real game changer. But beyond predictive modeling, the clinical landscape is just exploding with new tools. We have rehabilitation robots now that can accompany patients in sessions, providing precise, repetitive therapy while adjusting resistance in real time. Then there's telehealth and AI-enriched wearables that allow practitioners to remotely track a patient's range of motion and their adherence to a program. And finally, patient empowerment. We're talking about mobile apps that tailor home exercise programs, actively reminding and motivating patients. And we know that leads to better adherence and ultimately much greater satisfaction rates.
Which brings us to Section 4, advancements in physiotherapy research.
You see, AI isn't just changing how we treat, it's fundamentally changing how we discover what treatments actually work in the first place. In research methodologies, AI is acting as this incredible accelerator for innovation, while simultaneously raising the quality of our findings. Researchers can now use AI for complex data mining, finding hidden correlations in massive data sets that conventional techniques would completely miss. AI models can predict enrollment rates to optimize clinical trials. And this is a big one, as highlighted by Jennifer Summers' work. AI tools can automate the notoriously laborious tasks of literature searches and data extraction for systematic reviews. This rapidly synthesizes evidence, getting those crucial findings out to the physiotherapy community so much faster. Plus, it's generating real-world evidence by analyzing data from interventions happening outside the sterile, controlled environment of a clinical trial.
Now for a very important pivot. Section 5. Limitations and ethical challenges.
We definitely need a reality check here. Despite all these promising possibilities, implementing these powerful tools comes with significant practical barriers and ethical risks that we absolutely have to navigate carefully. The review points out a very real concern that an over-reliance on AI might diminish the personal connection between therapists and patients. Look, the human touch is paramount. It fosters trust, it builds empathy, and it manages the emotional and psychological needs of the patient. AI is a brilliant calculator and an amazing predictor for sure, but it simply cannot replicate the therapeutic alliance that forms the emotional core of clinical practice.
And beyond that potential loss of the human touch, the review identifies 4 major hurdles we face. First up, the high cost. AI currently limits access, especially in low-resource settings, which raises some very real equity issues. We can't leave people behind. Second is data privacy. Because AI requires gathering and analyzing highly sensitive patient data, it demands absolutely airtight safeguards. Third is the risk of algorithmic bias. Basically, if an AI system is trained on data that isn't representative of a diverse patient population, it can end up perpetuating biased or just straight-up unfair outcomes. And fourth is ethical and legal accountability. As we rely more on AI for treatment decisions, we have to ask the hard questions. Who is held responsible if an AI-guided intervention leads to an adverse outcome? The transparency of these decisions is going to be paramount.
Wrapping things up with Section 6, Future Directions and Conclusion.
So, how do we tap into the full power of AI while responsibly navigating these exact challenges? Well, the review outlines a strategic roadmap requiring action on 5 fronts. First, educational institutions have a clear mandate to integrate AI literacy into training right now. Second, continued research is needed to see exactly how AI links to real-world patient results over time. Third, interdisciplinary cooperation is vital. Physiotherapists have to work directly with data scientists to create solutions that are actually clinically relevant to us. Fourth, we need standardized guidelines for the responsible and ethical use of these technologies across the board. And finally, preserving that human core value. AI must complement, never replace the therapeutic connection. Which leaves us with this final thought for every student, educator, and clinician following this explainer. AI has the power to revolutionize clinical practice, optimize our research, and dramatically elevate patient outcomes. But its true value is only going to be realized if we fiercely protect the compassionate core of our care. So, as you move forward in this rapidly changing landscape, ask yourself, how will you wield AI to enhance, rather than replace, your therapeutic empathy? Think about that as you head back into your classrooms and clinics.